All right, so Krystal, what are you looking at today?
Well, relevant to this conversation, the New York Times being called out by experts for spreading COVID misinformation thanks to a fear-mongering article about kids and so-called long COVID. So here you can take a look at that piece. The headline says, "This is really scary. Kids struggle with long COVID." In that, the Times profiles several teenagers who struggled with a range of physical and emotional symptoms after contracting coronavirus. Those symptoms include everything from mental health issues to dizziness to vomiting, fatigue, brain fog. Now, outside of these anecdotes, experiences which have no doubt been stressful and scary for the teens and for their families, the piece offers very little data or hard science about the prevalence of such symptoms and no data whatsoever about the prevalence of the type of severe symptoms that are described in the piece. It also offers no insight into how a respiratory virus might end up, for example, noticeably impacting your brain, as is alleged in the piece. So as doctor, researcher, and Harvard Med School assistant professor Adam Gaffney put in an important thread on Twitter, quote, "I support dramatic public health interventions in hard-hit areas to slow COVID and buy time to vaccinate everyone possible. But I strongly dislike this irresponsible mode of reporting, which will scare the shit out of every parent with a kid with a cold. The hypothesis that a mild upper respiratory tract infection, even if caused by a new virus, causes a chronic dementing illness in children is a sweeping, massive, frightening claim. It is unlikely to my mind, given what we know about mild upper respiratory tract infections. But like all things, it's possible. Yet it is an extraordinary claim and requires robust evidence, which is thus far lacking. Our mantra that correlation does not equal causation goes out the window on this particular topic." Indeed, honestly, how is this article any different from some right-wing propagandist cherry-picking a few instances of a bad vaccine reaction to attempt to prove that vaccines are in fact dangerous? It is literally the exact same tactic. Find a few scary cases, presume a direct causal link that you don't know about, say the studies are unclear, paint a worst-case scenario, tailor-made, by the way, to play into your audience's particular biases and cultural predilections. But when it's done by the New York Times, it's actually a lot worse than some Facebook meme because you're spreading misinformation under the imprimatur of the most powerful and prestigious newspaper in the whole world. Conveniently left out of the Times scaremongering story is the fact that one comprehensive survey, which actually tested the blood of those who were claiming long-haul COVID symptoms, it actually found no difference in symptoms between those who actually had COVID antibodies and those who did not. So in other words, a lot of people thought that they'd had COVID, but they didn't actually have COVID. And just as many of those people who never actually had COVID reported long-haul COVID symptoms as the people who did actually have COVID. And it makes sense if you think about it, because there are a lot of reasons that someone might suffer the wide-ranging symptoms being described by the catch-all phrase long-haul COVID. That doesn't mean long-haul COVID is definitely fake or debunked or anything like that. Just that it is a very long way from the proven condition that the New York Times is painting it as here. Now, you might say, okay, but what's the harm really? Those right-wing propagandists, they are putting people at dramatic risk by persuading them to not get vaccinated. The Times, on the other hand, they're erring on the side of caution, which isn't a bad thing during a pandemic with a virus that we are still learning a lot about. Inherent in this argument is the idea that such caution is always a good thing, that it doesn't do any harm. That is just simply not the case. It's just that the burdens of an abundance of caution tend to fall on the least well-off and not, say, the Times' very well-off reader base, for example. In fact, the Times should be well aware of the cost of an overabundance of caution because they just published stunning new data on what a disaster virtual school was for millions of kids. Specifically, they found that more than 1 million children expected to enroll in public schools just never showed up. The plurality of those missing kids were kindergartners who, for whatever reason, were never enrolled and never, ever showed up to school. They found that in the 33 states where comprehensive data is available, 10,000 public schools lost at least 20% of their incoming kindergarten class. One can only imagine the lifelong calamity that might ensue from this lost year among our most vulnerable kids. Predictably, of course, schools in poor neighborhoods experience the greatest loss of students. So pushing terror on parents that could lead to school closures is not, in fact, a victimless crime. It's just that the victims come from families unlikely to pay for a New York Times subscription. And this is how class politics works, folks. If you're the Times' affluent audience, another year of virtual school, it's going to be a pain in the ass, but your kids are going to be okay. You can afford to err on the side of preposterously cautious. Not so for kids in households where time, money, and internet access are incredibly scarce. A year of virtual school turns into a year of no school at all, which turns into a lifetime of struggle. And by the way, if you're worried about death, being poor in America means you will die around 14 years sooner on average than the wealthy. Look, closing schools and other extreme precautions were understandable in the early days of the pandemic when we truly did not know how at risk children were of serious illness. But now we know, and thank God, the risk of serious illness for children, even with the Delta variant, continues to be relatively small. The social, education, and psychological costs of shuttering schools, however, were not small. Please, for the love of God, be responsible in your reporting on COVID. The stakes are high, and the material benefits of the additional clicks from your scaremongering are very, very low. And Kyle, I know this is something you've been tracking closely with the vaccines. Hey guys, thanks so much for watching.
That's right. Just as a reminder, you can become a premium subscriber today. Watch the full show completely uncut, our reactions to each other's monologues. You get to listen to it. You get to ask us questions, all that good stuff. Link is right there in the description or at breakingpoints.com.
Best of all, great way to say screw you to the mainstream media.